Alright, welcome to another episode of PharmD&ME. Today we're going to talk about hypertension. The guidelines that we're mostly going to be using are the J&C 8. There's several other guidelines you can use. For hypertension, as your blood pressure decreases, cardiovascular risk will decrease. So if you have elevated blood pressure, the more we can lower it, the better off you're going to be. And some things that we're worried about are cardiovascular events and kidney failure. Some cardiovascular events to look for would be myocardial infarction and stroke. And here are some normal blood pressure values. Normal blood pressure would be less than 120/80. You'd be considered pre-hypertensive if your systolic blood pressure was between 120 and 139 and your diastolic was between 80 and 89. Stage 1 hypertension would be classified if your systolic blood pressure was between 140 and 159, diastolic between 90 and 99. And then stage 2 hypertension, systolic blood pressure would be over 160 and your diastolic would be over 100. So in terms of treatment for hypertension, the first thing we're going to look at would be non-pharm options. A lot of this has to do with your diet, but there's several other things that you can do to help. So looking at diet would be sodium intake, and you want to have less than 2.4 grams of sodium a day. You'd want to lose weight, and ways you could go about doing that would be through the DASH diet. You're going to want to increase your physical activity and then stop smoking. Stop smoking is a general rule of thumb for just about every disease state. Okay. So next we're going to look at pharmacologic treatment. And these kind of get broken down based on race. If you're a black patient, you're going to want to start out with a thiazide diuretic or a calcium channel blocker, and then you can add an ACE or an ARB if needed, and you can do a combination of any of those three. If you have a white patient, you're going to want to start with a thiazide diuretic or a calcium channel blocker and an ACE or an ARB. And again, you can combine 2 or 3 agents if needed. All right. So when we look at the individual drugs themselves, your thiazide diuretics, they're going to include your hydrochlorothiazide. These are going to cause you to have a lower volume, fluid volume, which will allow for your blood pressure to lower. Some other diuretics that you could use would be your loop diuretics, which would include furosemide, aldosterone antagonist, which would include spironolactone, and both of those are better used in patients with heart failure. And then there's potassium sparing diuretics, but these would only be used in combination with another diuretic. The next drug that we're going to look at are your ACE inhibitors. These are all going to end in pril, like lisinopril, benazepril. These are contraindicated in pregnancy, and they can also cause a dry cough. It's a common side effect with ACE inhibitors. The next ones are ARBs, and these are going to end in sartan, like losartan and valsartan. These are also contraindicated in pregnancy, and there's not going to be as much cough associated with these. So it's if someone has cough on ACE inhibitor, you can put them on an ARB and they shouldn't have the dry cough anymore. And then finally is our calcium channel blockers, and this would include amlodipine. Some other options were the beta blockers, including carvedilol, propranolol, and then there's cardioselective beta blockers, which would be atenolol, metoprolol, and bisoprolol. Some other options that you could use in patients would be hydralazine, alpha blockers, and methyldopa. And that brings us to our special populations for patients with hypertension. The first one is pregnancy. Again, your ACEs and ARBs would be contraindicated, so the first line is actually methyl-dopa. If you have chronic kidney disease, you're going to want an ACE or an ARB. They're kidney protective. If you have diabetes, again, an ACE and an ARB for, again, the purpose would be to protect the kidneys. And if you have heart failure, diuretics, including loop diuretics, and ACE are beta blockers and spironolactone. The guidelines have changed some on the heart failure in terms of what drugs to use for those, and we'll go over that in another video. All right, so that is our hypertension video, and thanks again.